The government of Kenya wishes to confirm that yesterday, Thursday, 1st of February, at around 11:30 p.m., there was a huge explosion in this area where we are. One lorry of an unknown registration number that was loaded with gas cylinders exploded, igniting a huge ball of fire that spread widely, with one of the cylinders hitting a garment and textile Oriental go down, burning it down completely. Consequently, the inferno further damaged several vehicles and commercial properties. Sadly, residential houses in the neighborhood also caught fire, with a good number of residents still inside as it was late at night. As a result, 3 fellow Kenyans, not 2, 3 now, have regrettably lost their lives while being attended at the Nairobi West Hospital. The government sends its sincerest condolences to the families of the departed souls. In addition, by now, 280 other fellow Kenyans were injured by the fire and have since been rushed to various hospitals as follows. 43 at the Kenyatta National Hospital, which is our national referral hospital. 17 at the Kenyatta University Teaching and Referral Hospital, another level 6 hospital. 157 at the Mama Lucy General Hospital, because it's the nearest here. 18 at Modern Komarok Hospital. 21 at Garrison Hospital. 8 at Metropolitan, and as we had said earlier, 8 at Nairobi West Hospital, including 3 fatalities, and 2 at Radiant Hospital, 1 at Pendo Hospital, 3 at AAR, and we must commend them, and 4 at Nairobi Hospital. So that is a total of 280. Initially, we had a figure of 222. It moved to 271, but currently it's 280. Initially, we had 2 fatalities, but now we have 3. Collaborations with the Kenya Red Cross and the Nairobi County government is dedicated to providing essential support, including food and non-food items, to those affected. It is also true to say that the Kenya Red Cross has a platform to provide for cash transfer for those whose houses have been destroyed. In conjunction with the Ngao, DCC, they will do serious mapping so that there can be provision of some rent for at least 2 months or thereabout. So we are calling upon those who can support this initiative through that platform to really join hands. And also the county government will be able to provide food, blankets, water, and also other essentials, going forward. So it's good to say that, and the representative is also here. Have I forgotten anything you want to give? No. Yeah, so those are some of the interventions that we have here. Additionally, psychosocial counseling is being offered to victims who have experienced trauma at the desks located near the toll petrol station. And also the public is urged to report any missing relative